The most effective method to cure social anxiety using these 5 tips. A social uneasiness issue can influence anybody, paying little heed to age, nationality, or sexual orientation character. Side effects might incorporate the tenacious dread of being judged or embarrassed in explicit social circumstances, an exorbitant nervousness that doesn't fittingly coordinate with the tone of the circumstance. Patients battling with social tension some of the time try out advising or get drugged to deal with the manifestations of their uneasiness problem. On the off chance that you feel that your social nervousness has assumed control over your life and upset your capacity to deal with social circumstances, look at these 5 hints on relieving social tension at this point. What is social anxiety? What does social anxiety mean for someone's ability to function? To start with, how about we survey the meaning of social tension problem? While it is run-of-the-mill to feel apprehensive in specific circumstances, like a new employee screening or a supper with your accomplices folks, it isn't normal to encounter social fear and extraordinary uneasiness toward ordinary circumstances. A social uneasiness issue is frequently showed in serious dread or misery toward these social circumstances. An individual might stress that individuals will brutally pass judgment on them or reject them. These manifestations might be excessively extreme such that they ruin an individual's day-to-day routine. Social nervousness, otherwise called social fear, can be set off in an assortment of circumstances, for example, utilizing public bathrooms, going into a room loaded up with individuals, eating before another person, going to class, going to work, beginning another discussion, dating, going to a party, visually connecting with somebody, talking out in the open or giving a discourse to an enormous gathering of individuals, conversing with outsiders. While these circumstances may not appear to be nothing to joke about to certain individuals, they can in any case cause social tension and dread in individuals living with social fear. Normal causes of social anxiety. What makes somebody foster social tension problem? Like most emotional wellness problems, social uneasiness issue is brought about by the perplexing association among an assortment of organic and ecological elements. Normal causes come from acquired qualities, an overactive amygdala, and learned conduct. How about we investigate every normal reason for social tension together? Hereditary predisposition. Emotional well-being issues, for example, social nervousness can run in families. Notwithstanding, scientists aren't altogether certain whether this happens because of hereditary qualities or learned conduct. Amygdala. The amygdala, a design in the mind that could be associated with controlling the dread reaction, is now and then overactive in people with a social nervousness problem. Patients with an overactive amygdala will in general experience an uplifted dread reaction, bringing about expanded degrees of tension during social circumstances. Previous events. Past friendly circumstances that finished in humiliation might make individuals foster a social uneasiness problem. Climate. Parents who show tensions and fears toward explicit social circumstances might pass these inclinations onto their youngsters. Offspring of overprotective or over-controlling guardians may likewise foster social nervousness. Side effects of social anxiety. Social uneasiness can introduce itself through passionate conduct and actual side effects. Normal manifestations of social nervousness problem include staying away from social circumstances that may put you at the focal point of consideration. Sensations of extraordinary dread and tension toward conversing with outsiders. Dread of setting oneself in circumstances where they may be judged. Perspiring and shuddering. Powerlessness to pause and rest. Dread of feeling restless in friendly circumstances, which can wind up expanding one's nervousness. Blanking during an unpleasant or nervousness including social circumstance. Tenacity or fits of rage in kids. Body shaking and quakes. Sensations of low confidence. Hazard factors for developing a social anxiety disorder. An assortment of hazard components can expand one's odds of fostering a social nervousness problem. Family ancestry, individual demeanor, new friendly circumstances, or instabilities can cause social nervousness problem. While manifestations of social nervousness problem typically start in one's teen years, they can show up during one's grown-up years when they start a new position or make a significant show. Planning a doctor's appointment for social anxiety. In the event that you think you have a social nervousness problem, connect with your essential consideration doctor for an arrangement. Your primary care physician will probably attempt to preclude different conditions that could be causing your tension. During your arrangement, your doctor will play out an actual test, talk about your indications, and audit social circumstances that could be causing your tension. To make a finding for social nervousness problem, patients should encounter persevering trepidation or worry toward explicit social circumstances, aversion of tension-actuating circumstances, and over-the-top uneasiness that meddles with their life. 5 things to do if you have social anxiety disorder. Patients with social uneasiness issue regularly make an assortment of strides and way of life changes to deal with their issue. In case you are attempting to defeat your social tension issue, look at these tips for vanquishing it underneath. 1. Challenge and counter your negative thoughts. Individuals with social nervousness will in general experience the ill effects of negative and meddlesome contemplations. They might expect that a specific social circumstance could make them look idiotic or that they will humiliate themselves before an enormous gathering of individuals. Testing or countering these considerations is a viable technique for dealing with your social tension. Numerous patients with social nervousness additionally fall into the snare of participating in pointless reasoning styles. They may catastrophize an occasion or customize somebody's conduct toward them. To begin separating from these considerations, patients with social nervousness should distinguish any hidden negative contemplations they might be holding. They should then dissect and challenge these contemplations. By intelligently assessing their contemplations and feelings, patients with social uneasiness can shut down these negative considerations and supplant them with more sensible, good ones. 2. Maintain your focus on others instead of yourself. Individuals with social nervousness will in general become involved with their own uneasiness and nerves. Thus, those with social nervousness regularly battle to zero in on individuals around them rather than themselves. At the point when they center a lot around their dread and worry, patients with social tension can coincidentally prompt additional nervousness and weight on themselves. Try not. All things considered, attempt to concentrate on everyone around you. Start another discussion with another person or take part in a current discussion to take your psyche off your present nerves. Attempt to zero in on what the other individual is saying as opposed to tune into those negative contemplations pestering you. Social tension can be a bear to manage, yet recollect that it isn't just about as observable as you might suspect. Simply attempt to zero in on the current second decently well. As you keep on rehearsing this, your social uneasiness ought to ultimately become simpler to oversee. 3. Put forth a greater attempt to become more social. Challenge your social nervousness by searching out new connections and discovering strong social conditions to join. Something as basic as saying, "Hi," to your associates or asking them what they did throughout the end of the week can assist you with dealing with your social nervousness. As your endeavors at lightening your social uneasiness become simpler, ensure you keep on developing your new connections. A few patients who battle with social uneasiness additionally take social abilities class or volunteer with little gatherings of individuals. 4. Cut off unhealthy foods and habits. Your eating regimen could essentially affect your psychological wellness just as your capacity to deal with your social tension. Try not to devour unnecessary measures of caffeine from espresso or pop, as it can build your side effects of tension. Attempt to drink just with some restraint and abstain from smoking. Both liquor and nicotine can more terrible your social tension and its going with manifestations. 5. Attempt alternative treatments such as meditation and yoga. Reflection and yoga can likewise be unbelievably useful for individuals with social nervousness. Take a stab at matching these practices with somewhere around 30 minutes of activity daily to assist with dealing with your social uneasiness. Social anxiety in children and teenagers. Social uneasiness can influence youngsters and teens. While it is typical for youths to feel unsure and fearful toward being dismissed, sensations of tension that are outrageous or extreme enough to disturb their capacity to work regularly need proficient support. Social tension ordinarily creates around the age of 13. It can likewise co-happen with different problems like melancholy or ADHD. Social tension is more normal in females than in guys. Teenagers who went through a horrendous encounter are likewise bound to foster social uneasiness. Indications of social nervousness in teenagers are like those saw in grown-ups. On the off chance that you accept your kid is experiencing a social nervousness problem, it is basic that you plan a meeting with your youngster's pediatrician. Their doctor will play out an actual assessment and pose an exhaustive arrangement of inquiries with respect to their new temperaments and indications prior to making an authority determination.